we are doing a Femilift laser treatment for vulvovaginal atrophy, and the patient has some sexual dysfunctions and complaints. So we have offered a Femilift laser treatment along with PRP therapy for her. Femilift laser treatment is the treatment of choice in women suffering from genitourinary syndrome of menopause. The main symptoms are vaginal dryness, itching, recurrent infections, stress urinary incontinence, pain, burning and itching during intercourse, lack of sensation and desire during intercourse. All these can be a good candidate for laser treatment. We have completed with the Femilift laser treatment, and now we are proceeding with the PRP vaginal rejuvenation. So here we will be injecting PRP into the clitoris as well as the interior vaginal wall. PRP is autologous treatment and it is 100% safe with no side effects, and the patient can see the results after 1 month of the treatment.